Hello, everyone. Dr. James Marcum here with another biblical prescription for life. Today, I want to talk about the American Heart Association's new guidelines. I find these problematic on many levels. Just took my blood pressure here. Hope you're checking yours. 124/80. According to the new guidelines, I have hypertension that's not controlled. Wow. Before we talk about that, I want to go to something more important, and that's a biblical prescription, something that God has given us, spoken to us for eternal good. And the text I want to read is from James 3, verse 17. But the wisdom that is from above is first pure, peaceable, gentle, willing to yield, full of mercy and good fruits, without partiality and without hypocrisy. That's the wisdom that's coming from above. I'm not so sure we're having that wisdom from our medical societies. Especially the American Heart Association. Let me tell you why. They just came up with their new guidelines. I've been talking about high blood pressure for a long time. I'm a cardiologist. Here's some of the highlights of the new guidelines that you need to know about. One, we know that high blood pressure over years is a risk factor for dementia, cardiovascular problems like coronary artery disease, heart failure, kidney disease. We know that high blood pressure over time damages the inside lining, the endothelium, creates problems. But these guidelines, they're becoming onerous, and maybe they're not being done well. Maybe they're not being done with wisdom that's coming from above. So the new guidelines, I just measure my blood pressure. It's now considered high. They're saying that blood pressure is over 120 systolic, that's the top number when the heart first pumps, and 80 diastolic are not elevated. They go on to talk about the different stages. Stage 1, high blood pressure, 130, 140, stage 2, then they talk about severe. But they talk about very little about what really needs to be talked about. One number. We're treating numbers and not people. That's not wisdom. Wisdom is treating an individual based on their risk, their age. They talk a little bit about measuring the blood pressure correctly, but I see many people that get treated just because their blood pressure is measured under stressful situation, situational high blood pressure. They get a medicine, they overtreat it. I see many people and different older people on numerous medications. They take the medication. They get a little dehydrated. The kidney function changes. They keep taking their medicines. A little medicines become a lot of medicines. Then their blood pressure goes too low and bad things happen. They have cognitive problems. They can't think right, or they fall down, they break a hip, break a leg, they just don't feel good, they don't have energy, and yet they've made it to 85 without problems. The guidelines really needed to look at individuals rather than groups. They needed to look at different age groups. They needed to give some flexibility to individuality based on all these other medical conditions. I think these new guidelines definitely overtreat the older. They didn't spend enough time on measuring it correctly. And finally, they didn't even touch some of the things that we should touch as the cause of high blood pressure. Well, think about it. There's many causes of high blood pressure. Now, they talked about salt and alcohol and processed foods. They talked a little bit about diet. But what they didn't talk about is the elephant and literally the fat in the room. When up 42% of people are obese, and when up to 70% of people are overweight, we have a process in the body called insulin resistance. Too much fat, no matter where it comes from, carbohydrate, sodium, excessive calorie creates fat. Fat in itself makes chemicals that raise the blood pressure. Get rid of the fat, get rid of the blood pressure. They didn't even stress this. They barely touched on that. Then, once you have identified it, they didn't give us enough information on how to bring it down. Of course, they want to give it pharmaceutical, but they didn't talk about enough getting at the cause, focusing on that, and on which age groups and which organ systems that are not damaged, and how long can we focus on getting at the cause, treating naturally before we have to switch over to pharmaceutical treatment, which they want us to do because most of the people that wrote this have pharmaceutical ties. These are guidelines. These aren't rules. They don't affect everybody. They really don't look at you and I, the individuals. So what am I going to do with one reading of 120? I go to my doctor. Is he going to put me on another medicine with its side effects? And then if I get a little dehydrated because I'm giving a seminar, I get a little dizzy and fall down and bonk my head and have an intracerebral bleed. I see this in the hospital lots. People are overtreated, especially when they get older, when the risk of having it aren't as high. Those things weren't looked at. So the top organization that has many professionals are really missing some of the biggest picture. They're not focusing on some of the things we need to focus on. They're not treating individuals. Specific situations, specific risk. And they're not talking about many of the different things that can bring down the blood pressure. Well, what are some things that are natural? Greens, nitrates, beans, beets, intermittent fasting, getting that fat out of the body with exercise, less stimulants, garlic, and the list goes on and on. Well, I think I've ranted enough about the wisdom of medicine from this world. But let's go back to our text, James 3:17. But the wisdom that is from above is first. That wisdom is pure, peaceable, gentle, willing to yield, full of mercy, good fruits, without partiality, without hypocrisy. That is the kind of wisdom that we need today. Subscribe, comment. I'll be back soon with another biblical prescription for life.